Good evening, guys. Tonight's discussion Z, we are discussing weight loss drugs. Are they harmful to seniors? So, with that being said, here's the presentation I made for you. Sit back and enjoy. In short answer, a large new preprint found that rapid drug associated with weight loss in adults 65 plus is linked to higher rates of malnutrition. Low monitored oversight. Talk with a qualified healthcare professional before changing any treatment. The study and what actually showed a US preprint examining nearly 30,000 Medicare aged adults treated with trizepatide, or the uh, the name for that is Zepbound, offers one of the clearest early signals that the physiology of aging changes the risk profile of modern weight loss drugs. The analysis found that frail related conditions, including anorexia, dehydration, malnutrition, and sarcopenia, became more common as weight loss depended, especially when patients lost more than 20% of their body weight. These events were uncommon overall, but when they occurred, they carried profound consequences. Among older adults who developed malnutrition, the study observed roughly 25-fold higher risk of death over 18 months compared with Zepbound users who did not develop malnutrition. That that magnitude of risk does not suggest the drug is inherently unsafe. It suggests that older bodies respond differently, and that rapid weight loss can destabilize systems already operating with reduced physiologic reserve. The authors emphasize that the findings should not deter clinicians from prescribing GLP-1s drugs to older adults. Instead, they argue for structured monitoring, nutritional support, and functional assessment to ensure weight loss does not come at a cost of strength, hydration, or independence. Why older adults are psychologically different. Aging changes the architecture of the body, even in healthy older adults. Muscle mass declines steadily, reducing strength and balance. Bone density thins, increasing fracture risk. Hydration needs rise, while thirst clues weaken. Appetite also appetite also or appetite often decreases, making adequate protein intake harder. When GLP-1 medications suppress appetite, these vulnerabilities can intensify. Weight loss in older adults is rarely just fat loss. It often includes lean mass, bone, and water, each of which plays a critical role in maintaining mobility and resilience. Even small declines in muscle or hydration can trip an older adult into frailty. A clinical syndrome strongly associated with falls, hospitalizations, loss of independence, and mortality. Why this is why the same 20% weight loss that may be celebrated in a 45-year-old can be destabilizing in an 80-year-old. Mixed evidence. The story is not one directional. Some observational studies suggest that similitude and Zepbound may be associated with lower fall and femoral fracture risks compared with certain diabetes medications in older adults. With type 2 diabetes, these findings hint that GLP-1 drugs may improve metabolic, cardiovascular, factors that indirectly support musculoskeletal health. Taken together, the evidence suggests that GLP-1 drugs are neither universally harmful nor universally protective for older adults. Instead, outcomes depend on baseline frailty, comorbidities, speed and magnitude of weight loss, nutritional intake, physical activity, hydration, clinical monitoring. This complexity demands sense, not alarm. Practical implications for clinicians, systems, and families. Clinical monitoring. Start low and advance slowly in older adults. Track appetite, hydration, weight, trajectory, gait speed, and grip strength. Pause dose escalation if appetite declines or functional measures worsen. Protective measures. Prioritize protein-rich nutrition to preserve muscle. Prescribe resistant training as a core component of treatment. Use low threshold referrals to geriatric medicine, nutrition, or physical therapy. Policy implications. As Medicare expands access to GLP-1 drugs, coverage pathways should include funded frailty screening, nutrition counseling, physical therapy support, monitoring requirements. Without these guardrails, health systems risk preventable hospitalizations, fractures, and long-term care placement. GLP-1 drugs can deliver meaningful metabolic weight benefits for older adults, but in later life, weight loss must be treated as clinical intervention, not a cosmetic achievement. Rapid, unmonitored weight loss can erode muscle, bone, hydration, and independence, turning a therapeutic success into a functional setback. The study's warning is not reason to avoid GLP-1 medications. It is a call to integrate geriatric principles into obesity care so older adults gain health without losing the strength and stability that allow them to live well. A large new preprint and collaborating news analysts warn that rapid drug-driven weight loss from GLP-1 agents, notably Zepbound, can unmask or accelerate frailty in adults 65 plus. Malnutrition, dehydration, and muscle loss are uncommon, but when present, carry markedly higher short-term risks. So older patients need function-centered monitoring, nutrition, and rehab supports. Who should read this and what to ask? Baseline frailty, comorbidities, recent unintentional weight loss, appetite suppression, protein intake, and mobility. Clarifying questions for clinicians, families. Has the as the patient lost 10 or 20% body weight. Is appetite or fluid intake reduced? Are gait, speed, or grip strength changing? Decision point. If weight loss is rapid or appetite falls, falls, pause dose, acceleration, and trigger trigger nutrition plus physical therapy support. Consult geriatrics. Always discuss changes with the prescribing clinician. The study and its headline findings. A preprint analyzing nearly 30,000 U.S. adults, 65, treated with trizepatide, found that frailty-related diagnoses rose with greater achieved weight loss. Anorexia, dehydration, malnutrition, and protein energy malnutrition increased as percent weight loss increased. And those who develop malnutrition after Zeptide had a dramatically higher short-term mortality risk. The authors stress these events were uncommon overall, but serious when they occurred. Why older adults respond differently. Aging physiology matters. Older adults lose muscle and bone more rapidly. Okay, guys, so that is your shows for tonight. I will see everybody later. For now, Gator Wellness. Take care, folks.